Halberstadt, could you talk to us a little bit about bipolar disorder?
A bipolar disorder when a person experiences both episodes of mania and episodes of depression. Mania is characterized by rapid speech, euphoria, there's a sense of well-being, grandiose, the person believes he can do great things when he can't. Person has precious speech, talks rapidly, often overrides what other people are talking because the speech is so pressured. Sometimes there's irritability. Of course, there's euphoria. And this is on a range from hypomania, where the person is rational, intentional, meaningful behavior, but with these characteristics, versus mania. Mania is either psychotic or borderline psychosis, where people make up words, where people's thinking is illogical, and the grandiose is so grandiose it's based on not in reality. Versus hypomania, the person feels he could grand things, although within, but it's possible even though the person is overstating one's virtues and abilities. Depression can be sadness, flatness of affect, withdrawal, not wanting to participate in social events, and that's on the spectrum from mild depression to severe depression. With mild depression and moderate depression, a person is able to function, although the person is unhappy. Now, for treatment, one uses, particularly with one uses mood stabilizers, but it's also important to do counseling because this changed behavior lingers on in terms of the person's memory, and one has to work it through, bring back the person to a sense of reality, because he still can be disturbed by the behavior that had subsided, but it has a lasting effect. So it's not sufficient just to give medication. You have to work through the person's altered self that he's still experiencing but not practicing. It's not sufficient to tell a psychiatrist or internist that one has mood swings or one has highs and lows. This means nothing. The person has to define it, because we can have fluctuations in our moods. Some days we can be happy, and some days we can be dispirited. But these are just normal variation in our daily moods. It's only when we have this manic behavior or hypomanic behavior or depression that this is something that one should be concerned about and get the counseling. Again, counseling is important as an adjunct to medication. Without counseling, a person can have disturbing thoughts as an aftermath of what he experienced when he was depressed and or manic.
Are people who are manic sometimes reluctant to get therapy because it sounded to some extent like it might be enjoyable, like you said, euphoria?
Well, no, it's not necessarily, because it's not only euphoria, but people who are hypomanic or manic also be irritable and angry. It's a contradiction. Because of that contradiction, they're at the same time not trusting.
And how long is somebody manic? I mean, before they would go into this depression phase, I mean, does it vary? Or
it's a variation. It doesn't follow any pattern. It's an individual matter for an individual. There's no pattern.
So it's characterized by this manic phase followed by depression.
It's just diagnosed by the altered self. Again, it's not sufficient to tell a doctor that you have mood swings, because we all have mood swings. That's normal. It's when you get to the point where you can't function, as I had described, that this is a concern for therapy. Unfortunately, when people are euphoric, they don't see the need for treatment.
Right.
People can write bad checks, make poor business decisions, and gamble recklessly. Because when you're hypomanic or manic, in manic your judgment is almost nilch. When you're hypomanic, the judgment is affected by you being grandiose or euphoric.
Well, thank you very much for enlightening the audience. And on a practical note, for someone who wanted to come see you and had insurance, you take insurance?
I accept most insurance. I'm a provider.
And if someone wants to get in touch with you, how do they do that?
248-457-9667.
Well, thank you, and until your next installment, Dr. Halberstadt.